In between snowstorms this past week, we saw some encouraging news on the coronavirus front. On several fronts, in fact. Look at this. Researchers tracking the Omicron variant in wastewater from the KC Metro are seeing the numbers or viral markers drop sharply. And though rural areas are still having some issues and spikes, we're told there are indications infections could drop there in the next few weeks. Here's something else. Average daily new hospitalizations are trending downward in our area. They're down 20% in the last week, according to the latest numbers from the Mid-America Regional Council. We'll get some context on those figures in a second. Also, Pfizer asked the FDA for emergency approval of its coronavirus vaccine for kids under 5 years old, potentially opening up vaccines to the last age group not protected here in the U.S. This would mean 2 doses for kids as young as 6 months as of right now. An advisory panel will discuss the request on the 15th, which means potentially by the end of this month, we could see shots available. These are all good things, and it's good to be hopeful. Doctors in our area are cautiously optimistic, with a heavy emphasis on caution, understandably, mainly because they've seen encouraging news before.
We actually peaked a little bit ahead of most of the Kansas City area. And less staff are out due to COVID, and we are starting to scale back up our delayed procedures and all that. So those are the good news. But here is the thing that gives me a reason to be very cautious about it. We also lost a lot of people, and we continue to lose a lot of people to COVID. We lost 36 people in the month of January. That's a lot for us. And even in the last week, we had about 4 deaths. And the staffing shortages and supply chain issues have not gone away.
Last week, chief medical officers and infectious disease specialists across Kansas joined together for a virtual progress report, stressing while numbers are trending in the right direction, COVID hospitalizations are still the highest they've ever been. Quite a few times over the past couple of months, I've heard people refer to the pandemic as this thing in the past, like I did this back in the pandemic. But we're still in it. And though you may not be battling for health care or for your health, it doesn't mean someone else isn't. COVID-19 numbers spiked in January thanks to the Omicron variant, and hospitals saw pandemic records for deaths. Many communities are still suffering because of low vaccinations and underlying health conditions, or just overall lack of access to health care. Thousands of people in our area, specifically people of color, struggle to see a doctor or get the help they need. And this is a long-standing issue that started well before the pandemic, rest assured. So what's being done about it? Joining me now to get to the heart of the matter is Melissa Robinson, a Kansas City councilwoman and president of the Black Healthcare Coalition here in Kansas City. Thanks so much for joining us today.
Thank you for having me.
Yeah, my pleasure. First off, tell us about your organization and what your mission is.
Sure. The Black Healthcare Coalition has been around for more than 3 decades, and our mission is to eliminate health disparities in the African American community. We do that through 3 ways: advocacy, access to care, and health promotion. And so we're working in the grassroots ways to make sure that people are really connected to taking health seriously, and that we're addressing some of the underlying causes and root causes of the health inequities that we see so far too often. We're an organization that serves everyone. We know that, things like diabetes, heart disease, cancer, it impacts all of our community, all of our city. However, we're very curious and wanting to crack the code on why the deep, stark health inequities that persist within the African American community.
And some of what you just mentioned ties into the pandemic in a big way, too, as underlying health conditions. I mean, we have new numbers. The latest numbers from the CDC show Black Americans are more than 2.5 times more likely than white Americans to be hospitalized with COVID-19, and nearly twice as likely to die. That has to be an uphill battle for your team to try to help people in our area.
Absolutely. We've known for a long time that a lot of African Americans have dysfunctional relationships with the healthcare system, and not always the fault of their own, but when you show up, how you show up, and what happens to you within those healthcare systems oftentimes have you shying away from getting that advice that you need in order to continue on. So yes, COVID, when you think about the vaccinations in Kansas City alone, when other populations are hitting, 60, 70%, we're at 37% vaccinated African Americans. And it's more stark when you think about children. Only 19% of African American children that are eligible for the vaccine are vaccinated. So So those are deep issues, and we know that a lot of the hospitalizations have to do with comorbidities, things like hypertension, obesity, diabetes. Those things make you more susceptible and make the disease hit you that much harder.
You mentioned vaccine hesitancy, and it was very high in Black communities at the start of the pandemic. It has gotten better, but I mean, you have this long-standing historical and institutional racism that leads to that distrust in the medical community. How have you been able to ease those fears, I could say, and try to get people vaccinated? Are more people being vaccinated now?
We are really working to continue that effort, and we've done things like, COVID is real, and having those serious conversations. Right now we're talking about COVID continues, but we talked about, is the science safe? And we brought on individuals that look like us to say, look, this is safe. I'm doing it for me and my family. And now we're talking about the harm we do is to ourselves. And so while we're thinking about what everybody else is doing and what you're thinking that people want to do something harmful to you, the harm we do is to ourselves. And not being vaccinated, especially when we think about Omicron and how it does, the vaccination keeps you from serious illness and mortality.
Right.
We're really working on people really getting all their questions answered. But getting the vaccine is our best protection.
Last question, as we said, this has been an issue to healthcare access long before we ever heard of COVID-19. Aging is another big issue in the Black community.
Yes, we're working with KU, and we're working on Alzheimer's in the community, in the African American community, twice as likely to have dementia and Alzheimer's. And so while we know that the world is aging, everyone's aging, African Americans are suffering deeper from dementia, and we're wanting to help people through that.
All right. Well, Melissa Robinson, thank you for all the continued good work you do. We appreciate your time today.
Thank you.